Eleanor Roosevelt had this great quote. She said that poor minds talk about other people, average minds talk about events, but great minds, they talk about ideas. Yeah, of course I believe in LGBT rights. Of course I believe in women's rights. Of course I believe in minority rights. You know why? Because they're all individual rights. We all have rights as individuals. General Smedley Butler, one of the most decorated American soldiers in all of history, wrote an entire book called War is a Racket. The value of the dollar has gone down by over 96% in the last 100 years. The Second Amendment is not there so that we can go outside and hunt rabbits. It's there to keep us free. And actually, I would argue that if anyone needs the Second Amendment, it's minorities. Historically, unarmed minorities fare the worst in all of history. Those are the genocides we all hear about. Look, violence is wrong, all right? Whether it's cops or whether it's riots, it's unacceptable in a civilized society. You know what really gets me is everyone knows that the largest polluter on Earth is the U.S. government. All right, so how are they the ones going to solve the problem? You know what's insane is we have the largest prison population in the entire world, and over half of them are for non-violent crimes. Welcome to the Take On Everything podcast.
What's up, everybody? Welcome to a new episode of the Take On Everything. Thanks for joining me. There's no us. I was going to say us, but there's me and you, right? You guys are listening in. Again, 2020 has been a crazy year. There's a couple things I wanted to talk about. There's so many things to talk about. There's one thing I haven't really touched on, and I'm kind of surprised I haven't touched on it yet. The coronavirus, right? It's almost like it's such a given, and it's so crazy that everyone feels it, and it's kind of like we don't even need to talk about it, even though it's like one of the biggest and most important events for many different reasons that we've seen in a long time. I mean, if you look at death tolls, if you look at government responses, individual responses, economic responses, I mean, you can make the argument that it has more of an impact than what happened on 9/11, and that was the biggest event in my lifetime. And I was a kid at that time. I remember just being paralyzed. It's like one of those events where it's you knew where you were. I've heard people talk about that in relation to the Kennedy assassination or the attempt on Reagan's life, or just things of like huge magnitude. This is one of those moments. And I was thinking about it today. I was like, why haven't I talked about this? It's huge. Like, it's almost too big to tackle. So I'm sure I'll end up doing a couple different episodes on it, but I kind of wanted to just get some thoughts out. Again, I like the point of this podcast to kind of like, let's throw some challenging ideas out there, right? Let's try to not just be on one side versus the other side, which I think is an unfortunate response or an unfortunate symptom of something being politicized, right? And I'm going to touch on that too, and how that actually distorts facts and distorts how people react and where they fall on certain issues. So I just kind of want to talk about it. I want to talk it through, and we're going to go into more depth in later episodes, but I kind of want to give like a general, hey, let's maybe open our minds a little bit, take some considerations into masks, into lockdowns, into unintended consequences, into my favorite treatise of all time. I read it. It's by it's a treatise inside some writings by Frederick Bastiat. He was a philosopher and economist. He wrote it in 1850, and essentially the idea was anybody can look at a thing, see that the thing exists, and kind of understand how that thing got to be there. Furthermore, if you intentionally allocate resources or make a decision to make something happen, you can then see that thing happened. You can be like, yeah, you can call that an achievement. What you don't see is all the things that either happened that were an unintended consequence, or the things that never happened because you were so focused on this one thing, right? So I think that treatise, and if you don't know what that word means, treatise, it's kind of like a long essay, or like what would be considered like a peer-reviewed journal article nowadays. But people used to make treatises. They're a little bit shorter than books, but they were generally like scholarly articles. So here's this treatise that like fundamentally changed how I look at everything. I look not only for example, like a stadium, right? We can, like a local city government or something like that can pull together a bunch of resources and build a stadium. They can be like, hey, look at this stadium. It's huge. You can't miss it. It's right here, right? Look what we did. And most people will be like, yeah, I see a stadium. That's pretty cool. Looks like we did something. But what didn't happen because of that stadium, right? So that's a fascinating question. I just want to plant that little seed. And so start to look at things like, in economic terms, it's called opportunity costs. What are the opportunity costs for things? What do we sacrifice in order to achieve this one thing? Is that one thing, in relation to all the other things that didn't happen, is that an acceptable sacrifice? And if it is, cool. But just, learn to kind of like think that way, and to look for things for what, in terms of what they cost you, right? So let's give like a quick little overview of COVID-19. The pandemic, 2020's scourge, right? 2020 would hardly be a memorable year without it. So late 2019, we start seeing, especially in China and lots of other Asian countries, there's this, seems to be a fairly serious virus, spreads fairly quickly. It has a mortality rate that appeared very high compared to other viruses in the same type of family. Coronavirus is actually a very large family of viruses. It's had many different occurrences. Actually, COVID-19 scientific name is, SARS-CoV-2 or something like that. Because it's an iteration that's been done many times over, it's just a mutated form of an existing family of viruses, and we've seen countless numbers of mutations of it. We've seen SARS, you remember that? We've seen MERS, MERS, the Middle Eastern respiratory virus. And so this is, it's a virus. It seemed, a little bit more higher fatality rate, spread very quickly, so it gained some concern internationally. We saw Italy get hit fairly hard. Italy has a very much an elderly population on average, and they started to see a lot of cases. And one of the scary parts of the virus is that the majority of people do not show symptoms. And so you don't know like who's spreading it, right? So it can spread very quickly. Some people see that as a good thing and say, oh, you hear people say, well, the virus isn't real, or it's not dangerous, or anything like that. I'm like, just because it affects some people differently doesn't necessarily mean it's not real or not dangerous. It seems to be statistically more dangerous than most viruses. I think recently, it's October now, I think the WHO came out with their statistics. Initially, it was like a 6% death rate if you had contracted it. That was back in like March and April, so it was really scary. 6% is insanely high. That's terrifying. So yeah, a lot of people were nervous. But as we start doing some more testing and we start understanding, understanding that we need to test a lot of people, not just people that are showing symptoms, the WHO released statistics saying that the death rate for people that have contracted it across all age groups averages about to be 0.13% to 0.22%, not 2.2. So it's significantly less than 1% of people that die from contracting the virus. Now, it's much higher for people age 70 and older. It's almost zero. It's like 0.00 something for people under the age of 30. So on a continuum, this is statistically more dangerous than a lot of other sicknesses that we've dealt with. So it's a serious sickness. So let's take a look at the response, right? So Italy starts being hit. They go complete lockdown, 2 months straight, nothing, all right? We're here in the U.S. I assume that most of my listeners are in the U.S. If you're not, well, you can get a little first-hand view of what it was like here. A lot of people were nervous about it. A lot of people saw it coming and were concerned. But we didn't really do too much. In fact, when there were doctors on the West Coast that thought that they, people, everyday citizens were actually concerned. If they were getting sick, they were trying to go to the doctor so they get tested. There's stories of several doctors in the Seattle region that actually seriously thought that they had some cases of this, and they really wanted to test it, right? But in order to test for a previously unconfirmed contagion in the U.S., you have to get cleared by the CDC. So these doctors in Washington State, they call up the CDC and say, hey, I'm pretty sure that we've got some potential cases of COVID. We'd like to test them and quarantine them so it doesn't spread, which is standard procedure in medical community, okay? If you have a contagion, you test people, you test lots of people, anybody that could have come in contact with it, and then you quarantine them. That's standard procedure, right? The CDC is like, no, we don't want to cause panic. We don't have testing that's approved. We'll have to go through the whole process of developing some testing kits, sending it through trials, making sure it's safe and effective, all this. So the doctor's like, oh, okay, I think we should get out ahead of this, but okay, legally we can't, so we're just not going to. A couple weeks go by, and this turns out to be one of the earliest cluster cases up in the Washington region. The doctors, they start seeing more and more of these cases, and really high fevers and people becoming fairly sick. And this is a group of doctors. They just decided to test anyway. They said, "Screw it, Hippocratic oath first. We don't necessarily have to. Our oath is above the law." So they start testing, and they get positive tests back. Lots of positive tests. So all of a sudden, the confirmed cases jumped into the dozens, right? Because you had this cluster of cases. If the doctors had been able to test like they had the capability and the incentive to, I imagine that it could have been contained fairly early on and fairly with fair effectiveness, instead of letting people out into the community for, I believe it was 6 weeks from the time that the initial case, one of the doctors wanted to test for, but before the CDC actually relented and allowed doctors to do what they're supposed to and test and quarantine people. So it was already out in the community. It was kind of a lost cause at that point. If you stop doctors from being doctors, what do you think is going to happen, right? So right off the bat, the U.S. has completely failed in containing this virus. Okay, now we're in a terrible. This is when you start seeing cluster cases pop up in California, and then you start getting them on the East Coast in New York, and it's just like, oh, guys, everybody's kind of looking at each other as like, okay, this is probably going to be bad. So we screw up. For almost 2 months, we're just doing the wrong thing. Right, we're just not reacting, not allowing doctors to be doctors and test and quarantine people that need to be quarantined, and we're just kind of letting people go out in the community. So then we start to panic, right? You have, Donald Trump and Dr. Fauci. They start to, a story recently broke out that they weren't trying to cause any kind of panic, and so they just didn't say anything. They didn't do anything, which again, not a good idea. But so once they realize that they can't avoid this problem, it's not going to go away. We start hearing this flatten the curve thing. So now, because we're behind the 8 ball and we're behind we're late to the party, so to speak, and admitting that this could be a potential problem. Now it's like, okay, now we need to flatten the curve because we have an actual potential of overwhelming the medical system. So flatten the curve. This was the original goal. Just means that, hey, due to the viral transmission of the viral type spread of this disease, it can be very quick and spread throughout the community very, very quickly. So you have a significant uptake in cases and people that could potentially need hospitalization based on some of the data that we were getting from around the world. So we shut the economy down for 2 weeks. This was everyone had kind of this consensus. There were obviously some dissenters that didn't think it was necessary or were saying, hey, we should have done this way before so we didn't have to shut anything down. But you have kind of like a bipartisan, I'm talking about politicians, a bipartisan consensus that we need to just shut the whole country down for 2 weeks, and then we'll hop back on track and we'll be good to go. Because originally the claim was not that we're going to avoid all deaths and avoid all sicknesses. In fact, the early models assumed that everyone was going to get it until there was herd immunity. But the whole point was, as long as we don't overwhelm the medical system, we'll be okay because we'll be able to treat it. And so that happened, and then we just kind of like never opened back up because the goalpost kind of shifted from, okay, flatten the curve. Okay, now we flattened the curve, to now we're just not going to accept any COVID deaths. And then up now recently, it's now we're not going to accept any COVID infections. And so, I mean, let's kind of think about this just for a minute. So initially, there was no claim that we could even avoid everyone kind of getting sick like you do the flu or all other families of coronaviruses. It's really difficult to stop viral transmission. It's almost impossible, right? So the best for the last 150 years, the consensus of the medical community is that you need to mitigate the risks, have adequate supply of medical needs and doctors and nurses and all these things, and don't overwhelm the medical system, and then we'll achieve herd immunity, and then we'll be okay. That's the plan. It's going to be tough. We're going to get through it. This is what happened every single time. This is So in 2020, we have a brand new claim because of the moving of the goalposts from flatten the curve to lower the death rate to lower the infection rate to all this stuff. And so now that we're here and we've kind of moved the goalpost so much that we're in this phase where we can't accept any infections. Any infections is bad. It kind of goes against the history of viral medical community thought. But okay, let's see, did the reactions actually help? So how do we look at this? How do we even analyze this? So initially, I believe it was the Royal. It came out of the UK. They study kind of like viral transmissions, and they had a projection for the US, and they projected that 2.4 million people were going to die if we didn't do anything, right? And that's kind of what set the lockdowns in motion. Even Donald Trump was like, no, we're gonna react to this. We're gonna be strong, kind of like he does. He's very reactionary, but when he acts, he likes to be very dramatic about it. So he locks everything down. He's like, no, we're not going to do this because 2.4 million people are going to die. This is what Republicans, Democrats, everybody thought this was going to happen. So then we locked down. So where are we at now? We're at about 200,000, right? So initially, the numbers kind of point to, okay, maybe it worked. Maybe Donald Trump's initial shutdown and then the state shutting down after that actually cut it by a significant amount. We would go from 2.4 million estimated to just 200,000, right? A little over 200,000 at this point. So initially, are we going to call this a success? Is this what it looks like? We have to go back to the original study to kind of like take a look at what was this number based off of. It was based off of real good data as far as virus transmissivity. I always have trouble saying that word because it's kind of so many syllables. But so that wasn't the problem. The model wasn't the problem, but the assumptions were the problem. So at the time, we thought that the death rate of the infected people was so high. So they assumed a 3-point-something% death rate. It's nowhere near that, right? So it's below 0.2% coming from the WHO. So actually, the 200,000 death rate is kind of spot on. And that estimate comes from assuming we didn't do anything. No lockdowns, no masks, no shutdowns, no nothing. So okay, so that's just kind of conjecture, right? We're doing hindsight 2020. We're looking back at the model and we're adjusting for new information. Makes sense, but how do we know that this is actually true? How do we know that this revised model is true? Well, what we can do is we can look at other comparative countries that maybe did something a little different. So what are we going to look at? And I'm going to take an example that a lot of people actually know about. Sweden, right? We've heard that. Generally, people on the left are going to say, well, you can't compare these, the U.S. with Sweden. It's not a comparable thing. It's not the same density. And then people on the right are going to be like, well, if, according to your stats, blah, 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 we should have had this many deaths. And so it kind of gets really political. And so people fall in these arbitrary lines. But let's actually take a look at Sweden, right? So yeah, Sweden is It's a country of about a little over 8 million people. It is about the size of New Jersey. It's fairly small compared to, so it's hard to compare the scale to the U.S. But what's interesting about Sweden is they're one of the only countries that did not lock down anything at all, like at any time. There was no economic lockdown. There was no significant quarantining aside from retirement homes, populations that they knew were vulnerable. And there was no mandates of masks or any other kind of PPEs. So, I mean, how did they fare, right? So you'd think that even though they're a smaller country, you'd see a rate, a comparable rate that was significantly higher than the U.S. of infections, deaths, all this stuff, right? Economic suffering. And you really don't see that. In fact, you actually see the exact same infection rate and the exact same death rate. So it's almost like no matter what you do, people are going to get sick. And I think that falls in line with, I'm not a doctor. I know I'm not a doctor. I'm not trying to pretend I am, but I do know a little bit about viruses, right? Love science. I used to study science in school all the time. I have a decent understanding of viruses. And plenty of the information that actually comes from doctors, for forever, says that viruses, it's really hard to control a virus. It's much easier to control something like something that's environmental or a bacterial infection or something like that. It's much easier to isolate it within a population than it is a virus. You can quarantine a virus, which is the whole point of trying to control that. But for the most part, it's going to run its course, and there's not a ton you can do about it, right? You can do some things like the flatten the curve thing. I understand the argument for that. But I mean, if you look at Sweden, again, maybe it didn't actually have the intended consequence. There were at no point in the U.S., there were no times when the U.S. medical system in any place was overwhelmed. In fact, you actually had over 1.2 million medical professionals were laid off in the month of May because nobody was going to the doctor. The hospitals were at less than half capacity, and most of it wasn't COVID. They had stopped doing elective procedures. They had stopped doing routine checkups. They stopped doing cancer treatments. They stopped doing anything that was not COVID related. So nobody, and of course you didn't want to go to the hospital if you didn't have COVID. So since the systems weren't overwhelmed, they just laid people off. So you actually had a reduction of the workforce right in the middle of a pandemic because of the kind of the lockdown mentality. So both in the U.S. and in Sweden, there was no overwhelm. What is that word? They were not overwhelmed. The medical systems were not overwhelmed. I think that's an important thing to consider. It's almost like no matter what we did or they did, it was going to have a fairly similar outcome, right? And there's a lot of people that make those arguments. But let's, so a lot of people will make the argument that that Europe as a whole did a much better job at locking down than the U.S. You're talking about Italy, who had that 2-month lockdown. You're talking about Spain. You're talking about France, which all those countries had very significant lockdowns. And so the argument is, okay, the U.S. did a bad job, and Sweden, it's hard to compare, but Europe did a better job. So we should see lower rates in Europe, and you just don't see that. In fact, if you look at an exact, like a very, very good comparison between the U.S. and another place of its size, its density, its region, its diverse peoples. The EU is actually really, really close as far as the number of people living there, the geographical expanse, the different climates that are there, and you see almost exactly the same rates of infection and death and all that. So you can't. It's almost like no matter what you do, people are still going to get sick. Not that that's a good thing. It's just a reality, right? So to try to control it through kind of these unprecedented measures, these trying to eliminate infections, just doesn't seem to be realistic. I want to hop back on Sweden just for a sec. So the argument for Sweden is, again, that it doesn't have a comparable population. Its cities are less dense, and so you can't compare them. However, I almost think that's an argument that a mandate of lockdowns or masks is actually, it proves the point that it shouldn't be a one-size-fits-all policy. Maybe New York City could have benefited, such a densely populated city could have benefited from a mask mandate or business closures, which is exactly what they did, and they were actually the worst hit, both economically speaking, health-wise, and all of that, and compare that to any other place, and they did the most, and they were hit the hardest. So let's imagine that every other place in the U.S. that is not as densely populated as New York City would be comparable to Sweden. So maybe the argument is that New York City and Chicago and LA and DC and Baltimore and Phoenix and Houston, maybe those are the only places that you might want to do a lockdown and a mask mandate. And maybe every other place that is as dense as Stockholm in Sweden or its surrounding areas or less, they don't have to do a mandate, right? So it makes more sense. Like, if this is the science, if this is what we're seeing, if this is what we're looking at, then maybe we should act accordingly and not do a one-size-fits-all policy, but rather do something that makes sense. Like, if the data is showing us that we need a lockdown due to population densities greater than so and so 100,000 per acre or per square mile, or whatever your measurement is, whatever we're seeing, then let's do that. But just saying that that you in rural Appalachia and you in New York City both had the exact same mask mandate, and you both have to shut your businesses down, and you both have to stay home, how does that make any sense? So if we're seeing that a less densely populated area like Sweden, which it's a first world country, Stockholm's a big city, right? So if they're not seeing any of the benefit and they're not seeing any of the negative consequences of not locking down and not wearing a mask, then maybe every other place besides those cities I just named should be like Sweden and not have a mandatory shutdown or mask mandate or anything like that. Now, why am I kind of like picking at this? I'm picking at this because remember those unintended consequences we talked about earlier, right? We should consider the other things that are going on and the seen versus the unseen. What are the things that we're not seeing? So we're looking, if our goal is to reduce the virus, and it kind of seems like it's difficult to prove one way or another that it has been reduced or that it even can be reduced. And it doesn't mean that we can't take smart precautions, like I wear a mask all the time, because I choose to wear a mask all the time, and because it's mandated. But I limit my interactions with large groups of people. That's just what I would do anyway, right? But I also don't live in a very densely populated area, so I probably wouldn't be in much danger if I acted like the people in Sweden act. And guess what? Some of the people in Sweden voluntarily wear masks, and some of them voluntarily, social distance, right? But they didn't have anywhere near the economic problems that the U.S. had. It's estimated that 8 million people fell below the poverty line that were previously above the poverty line. Now they're below the poverty line. And I don't know about you, but 8 million people that were doing okay now worrying about where they're gonna get food. That's a cost, right? There's other reports talking about the increase in suicides is up almost 20%. The increase in domestic homicides is up 15+%. Domestic abuse in general is up almost 30%. So all of these other consequences are there. And if it can be assumed that even though we tried to lock everything down, and we tried mandates of one nature or another, and we tried to be responsible, we tried to do the right thing to save lives, if the science is showing us that maybe didn't work, and that these other consequences are direct results of this policy that we tried, but it doesn't look like it's working, then maybe we need to stop. Maybe we need to let the maybe more rural areas not really lock down, right? Or let them make the best decision. Like, for example, if I'm going to go visit somebody that I know is going to be susceptible, I'm obviously going to wear a mask. If I'm going to a large group of people, which I haven't, and I probably wouldn't be doing that anyway. But if I was, I would wear a mask, and I'd feel more comfortable if there was a mask policy there. But it should be based on the occasion, it should be based on the situation, and it should be based on people making the best decision for what they need to do, not shutting down somebody's businesses, whether you're in West Virginia or New York City or California. Like, that doesn't seem to make a lot of sense to me. So you have, some politicians are pushing like a national shutdown and a national mask mandate, and one size fits all policies. I think everything should be local. If my local community wants to do it, then cool, that's great. But it doesn't make sense to have this one-size-fits-all policy that obviously disproportionately affects one group of people over another. And there's even an argument to be said that it doesn't even make a difference even in the largely densely populated areas. I'm not saying masks don't work. They have a studied and proven effect. And I'm going to go here. Let me see here. There was a study done on the efficacy of masks by the British Medical Journal. They note that any mask that is not one of the surgical masks or the N95 masks, it has a 97% pass-through rate, which means that wearing any kind of mask cloth covering is 3% more effective than not wearing one. Very valid, which is, again, why I wear one. However, if I'm not going to be around anybody, or if I'm in a not densely populated area, or I'm around people that know that they're not immunocompromised and that are young people or whatever, maybe we should be able to just not do that, right? And it's not a thing one way or another. I'm just saying the one-size-fits-all policy, it's not necessarily the best way to go. And here's the other piece. When we initiated it turned out to be sort of a national mask mandate. All the states did it. Everyone rushed to get masks. Do you remember when you went to the store to get masks because you had to get a mask, but you couldn't find any masks, right? But you weren't the only ones to have that problem. There was a shortage in the medical community because they couldn't find masks. Then you start seeing stories about people going and stealing masks from hospitals because they were so scared that they took it away from the people that actually needed it. So in this same British Medical Journal study, it said that generally masks are not recommended for people to combat viral outbreaks. And actually, there is no substantial evidence showing that other than N95 masks, that even surgical masks reduce contamination of patients during surgery or infectious disease transfer to doctors from patients or to doctors from patients or from doctors to patients. So even the surgical masks are not proven to have a significant or substantial effect. And most of us are running around with cotton masks. So it's almost like it just makes us feel better. It makes us feel a little bit safer, like we're doing something, like we're controlling something. When at best we've got a 3% reduction, which again, I will take anything, which is why I wear them. I'm just saying there's another thing to be considered here, which is when people have masks on that increase or decrease their chances of spreading it or getting it from other people by like 3%. People tend to get a little bit closer to each other, right? This whole social distancing thing. Social distancing is far more effective than mask policies. Yet when people wear masks, they get really close to each other because they think they're safe. It almost has a malincentive to where people feel safer than they actually are. So then they do more risky behavior without realizing it. That could actually increase the spread of the virus. So there's been a lot of people that have argued that having a mask mandate actually makes people less careful and social distance less, Whereas if you saw, like, let's imagine that there was no mask mandate, right? And people would do it situationally if they're doing large gatherings, or if a local shop had a mask mandate, which again is perfectly reasonable. And let's imagine that was the case where people wore masks when they were trying to communicate that they were concerned, or they are immunocompromised, or that they would rather be around other people that were wearing masks. I feel like if it wasn't, if you took the politicization out of it, people would be much more considerate of those people. And the people wearing masks would be a signal of, hey, I'm concerned about this, right? And so instead, everyone has a mask. Half the people aren't wearing them correctly. And so it's kind of like this huge, big malincentive where people are not being as careful because the people wearing the masks correctly feel safer than they would otherwise. The people that don't believe the virus is real because they're a conservative and the Republicans tell them it's not real or whatever, they're not wearing it correctly, and you're walking really, really close to them. And then you have people that are wearing the masks in their cars by themselves, and it seems to be so irrational to me that I'm like, hey guys, can we actually look at what is actually going on and make some rational decisions? Like, maybe rural areas aren't densely populated. Maybe they don't have to have the same rules as New York City does. It blows my mind how irrational people get when things become a political issue, and it falls right down party lines. Right? Republicans, mask mandates are stupid. They don't work. The virus isn't real. Whatever. All these weird arguments that don't seem to have a lot of. They're not really based in science. The same argument goes for the people that, you have to wear masks all the time, even in your own home. We have to shut everything down to prevent all transmission of viruses. That's not based in science either. It's almost impossible. Throughout history, and the medical evidence shows that's not exactly the recommended approach. And I'm not just saying this. Again, I'm not a doctor, but I read a fair amount of stuff from the WHO. The WHO at the beginning of October came out and they said, we do not recommend lockdowns as the primary cause or the primary tool for preventing COVID-19 deaths. They actually released in that same statement that lockdowns actually cause more people to go into poverty and fall below the poverty line. And 20 to 30% of those people around the world end up starving to death or die from preventable medical conditions other than COVID. And so you actually could potentially have more people die from being poor than the virus, because they you lock everything down. So these are serious concerns. And so, and again, people on the right seems to be very irrational, saying that none of this is real. I'm going to go out. People tell me to not wear a mask. I'm going to breathe on them heavy. This is really ignorant stuff, right? As politics makes us do some really ignorant things. But again, you try to tell somebody that maybe identifies toward the left, or maybe a Democrat, and you say, hey, we should probably consider that there's a lot of people that are going to be cast into poverty if we just lock everything down indiscriminately, instead of taking we take a one-size-fits-all policy, lock everything down, versus hey, maybe this place doesn't have to be locked down. It doesn't make any sense to do that. Maybe we only lock down the large cities, or there's an argument whether that does anything at all, even in large cities, right? So, and then you try to say, hey, let's consider some of the economic costs and the people that are going to die of maybe starvation or lack of medical care. And they say, well, you just want to kill old people, or you don't care about people dying. Well, so no, that's the point. I do care about people dying. I'm just saying that just because people don't die of COVID specifically, and they die of starvation or other preventable medical conditions, or suicides, which are up by 40%, or domestic homicides, which are up by 20%, all these other costs, are we not weighing them? That also seems just as irrational as, conservatives saying the virus isn't real. They're both crazy, and it's what happens when things get political, is people get really stupid, So again, I'm trying to start a conversation with hey, there are real economic consequences which translate to human lives. Okay, and also the virus is real. It is very dangerous, and masks have some efficacy in certain situations. The WHO says that depending on the situation, the environment, whether you're outside, whether you're inside, whether you're around a large group of people or not, like that's how masks work, right? So they can help as a supplemental to, social distancing and just being overly considerate. Washing your hands is the number one thing you can do, and I bet more people put a mask on than wash their hands adequately, like the 2 minutes, right? When that's the number one thing you can do. Yet that's not politicized, so nobody gives a crap. Okay? So I'm just saying, let's talk a little bit of common sense here. Let's not get so wrapped up in politics and just toe the line of what people on our side tell us what we should be concerned about. And let's just stop being jerks to each other. I kind of live in a smaller town, and there's so many times where people will walk into like one of the local shops, which has been hit really, really hard over the whole shutdown thing. People, generally in small towns don't have a huge profit margin because you don't have a ton of customers, you don't have a ton of customer base. So you have like this quaint old town feel, small shops, this stuff that it's kind of like the main street, the main street feel. And people come in and they almost attack the business owners when they just ask them to put a mask on. Hey, it's a store policy to have a mask on, and they just attack them like they're the problem, instead of just being like, I'm just going to respect this person's wishes because I'm in their building. Right? So people just get really crazy and really irrational and really inconsiderate and really stupid when we politicize things. Again, in Sweden, who never politicized any of this stuff, most people wear masks depending on their social situation, right? Most people social distance depending on their situation. Most people are, wash their hands more than people in the U.S., but they never shut anything down. People were still having cafes. The cafes were like, they took the initiative. They put some more tables outside. They tried to spread people out. Like, people just naturally do the right thing as long as you don't politicize it, right? If I'm concerned, so one of my coworkers is immunocompromised, and we arranged it. She expressed her concern about being immunocompromised. Most of the people in the office weren't particularly concerned. We took necessary precautions. We don't sit super close to each other, but we're in the same office building. We wash our hands. We've got the Lysol that we spray down when we're around. So we're trying to be safe. But she was additionally concerned about it. So she's been working from home, and so it's like people don't have to have this one-size-fits-all policy. I prefer being in the office, right? She doesn't because she's concerned about her health. I'm not particularly concerned about my health. I'm fairly healthy. I'm young. I am in that bracket that has almost no chance of dying or even having symptoms of it. So I would rather be able to, on an individual level, hey, why don't you work from home? I'll work here. And the people that are not in that high risk category can work in the office, and the people that are a little bit more concerned or have that high risk, they can work from home, and we'll work it out, right? That's just what people do. We cooperate with each other. We work together, right? So what's wrong with that? And so Sweden has done that. You see pictures of this group of people over here. They don't have masks on. These two people here sitting next to each other on a bench, they have masks or whatever. You have cafes. They've got the table spread out. Nothing ever shut down. People continue with their lives. The economy didn't suffer. And they have no additional rates of infection or death rates compared to the U.S. or any other developed country. So I just think that this reaction, like we need to lock down and control everything because we're all scared, I think a lot of that comes from it being politicized. I don't think it's not dangerous. I do think it's dangerous. But I also think that human beings are pretty smart. And I think that for the most part, we cooperate with each other and we're fairly considerate as long as we don't have this external, I watched this funny video on YouTube where it was kind of like, Fox News and CNN. They were sitting next to each other, kind of whispering in people's ears as they were communicating with each other. And over the course of the video, they would whisper like more and more inflammatory things, like twisting what the other person said, until these two people that were having a civil conversation like are at each other's throats. And I feel like that's kind of what's going on, is that there's no rationality, and there's almost this incentive to like see everyone else as your enemy, right? They're on the other side. They disagree with this particular thing, and therefore, literally, like, no joke, they're trying to kill you, or they're trying to kill us. They don't care about human life. And that could be a fair argument because they're being just as irrational. I feel like both sides are being just completely irrational and trying to just force their narrative. So the people that are concerned about the masks are trying to make everyone shut down and everyone wear masks at all times and we need to shut everything down at all costs, and as long as nobody dies from this specific thing, you can die from other things. Like, that just sounds crazy to me. And on the same level, you've got people running into stores, making it a point to take their masks off and be really obnoxious about it. I'm not just talking about one or two instances. This happens all the time. You can find videos. I've seen it in person. I've heard personal stories, firsthand accounts. You can see them on YouTube, on news reports. People are just being complete jerks about it. If somebody's concerned about something, somebody's word, be considerate. Most people are considerate unless you politicize it. Then everyone turns into jerks. So I'm trying to just interject a little bit of reason, a little bit of humanity, a little bit of social cooperation, a little bit of understanding, and a little bit of unity. Maybe we can pull together and get through this thing. But I think if we continue to act the way that we have been acting, we're going to have much worse consequences than we otherwise would have. So my plea is for sanity. My plea is for a little bit of consideration, understanding, and humanity at the very least. So I kind of just want to end by saying a lot of the things I'm saying sound like, talking points from one side or the other, but I feel like a lot of the talking points that I have are, some of the talking points from either side are true, or I have some truth in them. And so I would encourage people that have one opinion or another and disagree with half of what I said, whatever side you're on. Try to listen to both sides with an open mind, and I feel like you may, since both sides have a little bit of truth to them, you may come to some reasonable middle ground that makes a little bit more sense than these polarized and devoid of reason conclusions that people have miraculously fallen upon on this. What are the chances that it falls along party lines? It makes me laugh a lot of times when so predictably, if one party has this line, right, then everyone else falls into line. They toe the party line, and there's no deviance from it. And very predictably, the other side will toe their party line as well. And then there's just bickering back and forth. And then for everyone else that's on the sidelines, that isn't like this diehard right or left person or Democrat or Republican or whatever, we just kind of look back as like, you guys aren't making a ton of sense right now. We think you're a little bit crazy. You might want to sit down before you hurt yourself, kind of thing. So I'm appealing to the independent-minded people, the people that still believe in a little bit of reason and a little bit of social cooperation, and the belief that human beings can make the right decision as long as you don't put them at each other's throats. So yeah, I'm basically ranting at this point, but I think they're important conversations to have. I'd love to, if anyone has comments, feel free to comment on this video, and we'll have a discussion about it. I think it's a great thing to talk about, and I don't think any one particular political proposition is going to solve our problems. I think it's going to be cooperation. I think it's going to be working together, and I don't think in any case it's going to be one size fits all that solves the problems for everyone, since everyone has different needs. Whether you're elderly, immunocompromised, young and ready to work, or poor and concerned about where your next meal is coming from, everyone has different needs, and so to force everyone into the same box, I think, is dangerous and will have disastrous consequences. And with that, I'm going to end the show. And as with always, if you guys want to support the show, I do not have a book that I'm recommending this time because it's more of just my rant, but I still do have Liberty Classroom as a sponsor. Basically, I explained it in some other videos, but it's like an affiliate marketing thing where, Liberty Classroom, they teach some great history, economics, philosophy, political thought, law, whether it's natural law or positive law. They have courses that are like college level or even high school level, if you're a high school student or a college student or just like to learn at that level. They have some pretty great courses that are taught by renowned professors and experts in their field that are able to kind of take that information and present it in a light that is very much pro individual freedom, individual liberty, human well-being and that kind of thing. And I really appreciate it. I've learned a ton from Liberty Classroom. I am a lifetime subscriber there. So basically, if you want to learn about all of those topics, history, civilization, philosophy, economics, all this wonderful stuff, and you want to learn it from that type of perspective, go check it out. But if you do want to sign up, use my link that will be in the description, and I'll get a little bit of a kickback on that. That'll help support the show, and you get what you want, and it doesn't cost you anything extra. It just gives me a little bit of kickback, and I would kind of appreciate that. So, guys, as always, thanks for tuning in. Thanks for listening. Love having you here, and I hope this kind of spurs a little bit of thought, a little bit of conversation, and a little bit of coming together in this unprecedented time. So, all right, peace out.